Oh, one of your nurses?
I
Did
think
I
so.
hear
That's
that?
what I heard.
Okay, because that's what I heard as well.
Thank you.
All right, very well. Okay, one of your nurses indeed.
Oh, okay.
Okay, all
Thanks
right.
for calling.
Oh, so you don't know your nurses? There are so
No,
much.
I didn't hear the name.
The name. Oh,
You know, the line
something
was
Suleiman.
faint. Oh,
Something.
Suleiman. Oh, okay.
Alasan.
Okay, I know him.
You know,
Yes,
right.
please.
Very well. Uh, so the stress it came with the. Let's talk about the symptoms because I want to know. Is it? You said it was slow, but were there medicines that were easing it? How was the treatment like? So
I
that
didn't see the medicine easing it. I was even thinking that the medicine was even making it worse because you could see that when we get to the hospital, that was when things were deteriorating, okay?
Oh my.
Yes. You could blood coming from the teeth, the nose, and a whole lot. In fact, when you get to the hospital, you see my child. Most pastors will come and they will look at you and say, this is spiritual. That is what they normally tell you. And they start giving you their number, you should do this, you should call them a whole lot. But honestly speaking, the stress was too much for me to follow.
yeah.
I had to call and start. And that stress, they will tell you this person is doing you or those kind of things. So I didn't at all. When I get to the hospital, it was even worse.
Wow.
Yes, it was worse.
is it perhaps a case again? You made this the case of we not having any specialists or special plays. Is
As
it
at that
perhaps
time, it wasn't. I think Kolebu was the only center at that time, just 12 years ago, right?
Yeah.
Yes,
Yeah.
I don't think that's the only place that had a major
do we have
cancer
them now?
unit
A lot of them now.
Now we have quite a few. You know, we have one at Rage, we have another at Confanoche. I think Ho also has one, and then
What teaching
Teshiman.
hospital?
Yeah, and then the Holy Family or something. There's also another one that has. We have a few now, but in the past it was quite bad. I think Kolebu was just the major place where everybody was going to. So Profena had a lot on her plate. She and Dr. Sigbefia, yes, they had to handle the oncology cases for the children.
So would you want to make a case that it's a place we need to put our monies? Is it
Yes,
that
it
rampant?
needs a
Looking
lot
at the
of-
numbers, I'm looking at the numbers now. Do we
Yes.
have it?
The numbers, people are underreporting because
right,
ideally,
yeah.
we estimate at least about 1,000 should be reporting every year. We have only about 300 people reporting because most people will go to the prayer camp, like you said, because of the way the child looks. You think that will be near or you know that kind of attitude, or you know, so you have some enemy somewhere that's cursing you. So people don't really seek. They'll be hiding or they'll be doing other things, thinking that oh, it's just a minor thing, it will go away. So because we don't really know the symptoms, we have to increase more, raise awareness about it, so that everybody gets to know what the symptoms are. So when their children come complaining of certain things, the parents will take them seriously. Yes. And they'll also be observant. If a child has a lump anywhere, whilst you're bathing your child, be looking out for all those things. Look at the child's eyes. Does the child look jaundiced? Does he have any enlarged liver? Just be touching your child's body. You should be more proactive. Yes. And if you see anything that's abnormal too, please seek treatments. A lot of people are very hesitant to go to the hospital. I know, yes, sometimes the queues can be quite long and overwhelming, but at least just take the chance and go. And now to the treatment for childhood cancers on the NHIS. So at least that reduces the
Yes, the Vice President mentioned
yes, he just did it
it.
recently, yes. I think it was the Vice President and his wife that made the initiative. So I think it's now on the NHIS, so at least it's going to reduce that aspect. So they just have to pay for probably the lab tests that they need to do, the kidney test, the full blood count,
that's not
the bone
part.
marrow. No, not yet. That one is not part yet. And that one too, for all of them, it's an estimation of about 3,000 CDs.
Hey.
You know, yes. So
That's without
that's
the
without it.
intervention
Yes,
of the Vice.
please.
Hey, dog.
That's just for the labs. Because you have to do frequent labs. So she did like more than 10, 20 lab tests.
yeah.
Yes, you keep on going. Because we need to know how you are doing on the treatment. Are you getting better? Are you getting worse? We know that we have to change the drugs that we're using, the
Hey,
chemotherapy.
I know
that
some
we're
parents will not face this embarrassment to say, go and bring this money, and they don't have
exactly, they
anyone.
don't have anyone. So that's the challenging things. We don't have a lot of funding for that particular problem, this childhood cancer issue.
Then it goes back to
I
the
mean, there are one or
conversation
two
we're having
foundations,
before
though,
we came
but
here.
yes, the financial aspect is very important too. You know, in
How
Africa
about the
too, we have
practitioners
limited
in there,
resources.
the specialists? Do we have a lot of them in the country?
So many. I mean, there's still that are being trained, though, but they're not a lot. At least 10, 15 you should have. But if we could get more, I think it would do us a lot of good. Yes, because clearly we are seeing more of it, you know, and so at least if we had more people to treat it, and if people were being trained to look out for these problems, then we can diagnose them very, very quickly
I see.
and then start the treatment.